What crosses the placenta? So we can see that substances such as oxygen, carbon dioxide, water, electrolytes, and if you see even the anesthetic agents. So these substances they can pass through the placenta, and this is by the simple diffusion. Next, if you see the immunoglobulins such as the IgG. So if you look at the IgG, it has a molecular weight of about 160, about 160,000 molecular weight. And now looking at this mechanism, the mechanism is by the endocytosis. And this is, if you see, it is via the Fc receptors, and this is in the trophoblast. Next, we look at the other substance, that is the glucose. It can also cross the placenta. So this glucose, it is facilitated. There is a facilitated diffusion. And this diffusion occurs via the glucose transport proteins, and this is nothing but the GLUTs. Next comes the amino acids. So if we look at the amino acids, it is by the mechanism of transport protein mediated active transport. Next, if you look at lipids, so in case of the lipids, such as the glycerol, the essential FA, that is fatty acids, and the LDL. So here, this is by the mechanism of the endocytosis, and this is via the specific receptors. Next, even the minerals, if you see, it can transport through the placenta. So the minerals, and such as the iodine. Next, it can also be the iron. So this iron is unidirectional, and this is from the mother to the fetus. Next, what we see is the calcium, as well as the phosphorus can be seen. So all these minerals, it is transported. So if you see the minerals, it is transported by the carrier mediated active transport. Next comes the vitamins. So vitamins, you have the A, C, and D. So the A, C, D vitamins, it is carried. There is something known as a carrier mediated active transport. So this is how it is transported.